Good evening, ladies and gentlemen. Today's group project is on dental anesthesiology by Vladimir Santamaria and Tyson Nguyen. The picture reads, unfortunately, your HMO does not cover anesthesia. We are going to have to use our low budget procedure to put you out. This is referring to insurance companies not covering anesthesia. So what is dental anesthesiology? So dental anesthesiology is a specialty that helps patients undergo dental and oral surgery treatment by providing sedations and general anesthesia care. A dental anesthesiologist provides a patient undergoing oral surgery treatment that they may not otherwise be able to receive by providing advanced sedation and general anesthesia care. So the history of anesthesia. Anesthesiology has been the practice of dentistry since dentists Horace Wells and William T.G. Morton first discovered the miracle of anesthesia for painless surgery by administering nitrous oxide and diethyl ether, respectively. Horace Wells and William T.G. Morton are the two founders of this practice because they were the first to discover it back in 1844 and 1846. The first person to use anesthesia was Dr. Morton when he administered it to a patient of the chief of surgery at Massachusetts General Hospital. This act got the attention of Dr. John Collins Warren, Dean of Harvard Medical School and the primary founder of the New England Journal of Medicine and Surgery. So, according to history, Horace Wells was the one that discovered the nitrous oxide, aka laughing gas. And at the time, he was partners with T.G. Morton. But, like all partners, they had a falling out. So T.G. Morton ended up finding anesthesia a few years later. So T.G. Morton, back in the days, was credited with anesthesia. It wasn't until later on that Horace Wells was also credited for finding anesthesia. The road to dental anesthesiology. In order to become a dental anesthesiologist, one must be a doctor of dental surgery or a doctor of medicine in dentistry. In addition to having a doctorate, one must attend a 2 to 3 year residency in a dental anesthesiology program. These programs must be accredited by the Commission of Dental Accreditation. In other words, an individual needs to spend a total of 8 years to achieve the required credentials for a dental anesthesiology residency. According to the Healthcare Administration, the syllabus includes anatomy, biology, organic chemistry, physics, etc. Students are required to learn these subjects in addition to learning other skills such as techniques to alleviate pain and intravenous sedation. In addition to having to go through 2 to 3 years residency program, students must pass both written and oral American Dental Board of Anesthesiology examinations. The American Dental Board of Anesthesiology recognized as National Certifying Board for a dental specialty. As of March 2019, dental anesthesiology is a recognized dental specialty per the National Commission on Recognition of Dental Specialties and Certifying Boards. Dental anesthesiology shows that it is a distinct specialty, well defined, and that it requires unique and advanced knowledge and skills. It also contributes knowledge, education, and research into the dental profession. So as you can see, dental anesthesiology is still relatively new, officially becoming a dental specialty in 2019. So prior to that, dentists had to get with hospitals, and hospitals would provide the rooms, and they would provide an anesthesiologist specialist to conduct the anesthesia on its patients. So anesthesia it's mostly used on children and people with mental health problems or special needs for the most part. There's also the patients who have anxiety problems or the ones who are very nervous or scared about having dental work done on them. ADA, American Dental Association. According to the ADA, sedation may involve gases that are inhaled, pills that are taken, or medicine which is injected. More complex treatments may require deeper sedation to relieve both pain and anxiety. On occasion, general anesthesia may be used to cause temporary loss of consciousness. There are further guidance, rules, and regulations by the ADA. The administration of local anesthesia, sedation, and general anesthesia is an integral part of dental practice. The American Dental Association is committed to the safe and effective use of these modalities by appropriately educated and trained dentists. The purpose of these guidelines is to assist dentists in the delivery of safe and effective sedation and anesthesia. So the next couple slides are going to show the guidelines that I took the liberty of getting from the American Dental Association.org website, and they're just guidelines that provides to anesthesiologists about the types of sedations. As for example, there's minimal sedation, deep sedation and general anesthesia, and moderate sedation. Okay. So for my works cited, I went on anesthesia and sedation on on ADA.org. So you can find most of this information on ADA.org, and you could also go on www.healthcareadministration.com. Okay, so this concludes the group project. Thank you and have a nice day.